Hi, Dr. YASS here. In this video, I want to discuss the literal chasm between what you could expect from the medical system versus the YASS method when looking to diagnose and treat knee injuries. I recently did a Zoom session with a woman, and her situation, I think, so clearly represented why trying to diagnose through the existing system is probably going to lead to chronic pain versus the use of the YASS method, which will lead to an immediate, appropriate diagnosis, which in cases where it's shown to be muscular as the cause of the symptoms can be resolved in like an hour, hour and a half time. And that's the magic of the method. Muscular causes will never show up on diagnostic tests, and there's no medical specialist educated or trained to identify them. That's what you got to understand. When you go to that orthopedic surgeon and he provides you with a diagnosis relating to a structural cause, you think that he's tried to derive that diagnosis from thousands of possible causes. It's just absolute nonsense. He only has, or she only has, one or two choices when it comes to the knee. It's a meniscal tear, it's arthritis. That's basically it. So when that MRI shows or an X-ray shows a meniscal tear arthritis, and they're like, oh, that's the cause, you say, wow, of all the possible choices, he actually confirmed, or she confirmed that. It's nonsense. That was it. It's going to show that. There's no confusion about that. You think if you're over the age of 40 or 50 that you haven't had some sort of degenerative changes to your joints, that it's shocking that they're going to find some level of a meniscal tear or some level of arthritis? Clearly, you're going to find that. So to simply say because it was found at the time you're having your pain and therefore it's the cause of your pain is insanity. It's insanity. The question I would ask, can you guarantee me that that arthritic change or meniscal tear wasn't there before my symptoms began? And the answer is no, they can't guarantee that. And the reality is, the highest probability it was there before. So when you get these diagnoses, don't think that they're based on anything other than an assertion, a correlation, that since it's found for the first time while you're having your symptoms, it must be the cause of your symptoms. That's pure insanity. Insanity. A very quick study will show that of the people who don't have pain in the knee, of those who have pain in the knee, 63% are found to have meniscal tears. Of those people who do not have knee pain, 60% are found to have meniscal tears. Those who have pain, 63% are found to have meniscal tears. Of the people who do not have knee pain, 60% are found to have meniscal tears. How do you account for that? The answer is quite simple. Meniscal tears don't cause pain. It just so happens for those who found the meniscal tear while in pain, that pain was being created by another tissue in the area. That's the only reason the meniscal tear was found while they're in pain. That doesn't mean that because it's found while you're in pain that it's the cause. That's what you have to wrap your heads around. So here's an example, a really classic example. This lady is standing on something. She thinks she's going to be stepping down right onto the ground. Turns out she's actually 3 feet above the ground. She goes to stand down. She feels this kind of hyperextension of her knee. She feels a pop. All of a sudden, there's massive pain. She sees some swelling develop. She then has difficulty walking, goes to an orthopedist without even attempting an MRI. Now they're actually making the determination, even without the MRI, is told you have a meniscal tear and you need surgery. And she's like, how do you know that? What's the representation that it's a meniscal tear? And he says, well, the pop. So the pop equals meniscal tear. In 27 years of doing this, all the people who have felt a pop at the knee, it was a straining of the hamstring. And the hamstring tendon happens to attach right to the sides of the knee. So the pop was not something structural. It was actually a strain of a muscle, which makes more sense because a sudden need to stabilize the knee is going to cause a tremendous force output of a muscle, probably beyond its capacity and leading it to strain. So she has that happen. She's very hesitant to follow up on the surgery because the guy is giving her no confidence that he actually knows what's creating her symptoms. So she just kind of sees if she can struggle along and hope that it's going to get better. 3 months go by. It's worse than it's ever been. She can only bend her knee about 40 degrees back. She is struggling to walk, function. She's now getting pain near the ankle and the hip region or the top of the thigh region. She's having difficulty sleeping at all. She can't find a comfortable position. Things consistently are getting worse and worse. Just so happens the lady knows a lady that I actually treated her and her son, and this lady happens to see her in a brace and says, oh, there's only one guy you really need to go to. So I decide to do a Zoom session with her. Quite luckily, her son happened to be there, and it allowed me to do some tests. I muscle tested and found that the hamstring on the affected side, there was no strength. I checked, and so I asked him to push into the thigh, and we found a lot of tenderness in the front thigh, indicating the quad had strained and was knotted. And then I asked him to move the kneecap side to side, and on the side of where she was having the pain, the kneecap was completely loose. There was no tone from the quad. I'm sorry, it was excessively, that's right, it was excessively tightened. They couldn't move the kneecap. And that was because the quad had shortened so severely and it was pulling up on the kneecap that it was pulling so excessively you couldn't move the kneecap side to side. That's called decreased lateral mobility of the kneecap. So between weakness of the hamstring, no mobility of the kneecap, and knotting and an indication of tightness of the quad, I was immediately able to indicate that the cause of her pain, just as I had told her over the phone before I even evaluated her, was most likely a hamstring strain, was confirmed. That was done in 10, 15, 20 minutes. So the answer was that the pain at the kneecap was simply the fact the quad was pulling up on the kneecap too much and it was compressing it excessively. So there was no room for the kneecap to glide as she bent her knee back. That was it. So I said, first thing we're going to do, hamstring curl. We're going to start strengthening up her hamstring, the posterior thigh muscle, the muscle that opposes the quad. Many people will tell you the answer would have been to stretch the quad, but stretching doesn't change the force, the force limitation between the hamstring and the quad. There is no hamstring strength, so it's not allowing the quad to be maintaining its length, and the quad tension causes it to shorten. So stretching it was never going to fix it. You needed to strengthen the opposing muscle to the quad, which is the hamstring. We do the hamstring exercise, and inside of 3 to 4 sets of progressively increasing resistance, we get her to 90 to 100 degree bend. She's now able to bend her knee to at least 90 to 100 degrees. She can sit with her feet on the floor with zero tension. Remember, she started at 40 degrees. She could only bend to 40 degrees. I asked her to get up and walk, and all of a sudden, she's like, oh my God, I can move my feet directly through. I don't have to wrap around. I don't have to lift my hip. I don't have to do anything. So she's already seeing the big improvement in her functionality, her ability to walk. So we continue on, and all I have to do is 2 other exercises. Hip abduction, which strengthens the muscle on the side of the pelvis, which will give her stability when she stands. And then hip extension to strengthen the butt muscle, which allows her to stand upright so that she's weight-bearing through her joints properly and there's no excessive use of exercise. It took us an hour and a half. We did 3 exercises. By the time she was done, she told me straight out she could not go down a flight of stairs step over step, putting one foot on a step and then going down to the next step with the other foot. She could only go step to step. I asked her to do it. She was able to do it 100%, no problem. She told me she couldn't get her leg into the car without lifting it with her arms because she couldn't bend her knee to get it in. I told her to go down and put her leg in the car. She did it 100%. She came back. She was so emotional because within an hour and a half, she was able to do all the functional things she was incapable of over the last 3 months. Worst off, over those last 3 months, she was beginning to believe more and more she was never going to go back to normal. So she was starting to have depression coming in, hopelessness. She suddenly realized that it was a muscular cause, and control of that muscular cause was simply within her power. Hour and a half, full function returned. What was the alternative? She doesn't know, the lady that knows me, what's going to happen to her. She's going to be forced to try some therapy, some other crap. Nothing was going to be able to recognize what the true cause was. This straining of the hamstring leading to shortening of the quad. And so she would have kept the pain, and eventually she would have been coerced by the orthopedist that since nothing else worked, the only alternative was to get that surgery, which would have led to a failed meniscal surgery, leading to a failed knee replacement. This lady would have been crippled, period. That's the way the system works. This is the example, clear as can be, between what you get when you go to the existing system versus the YASS system. By the way, let's make sure we understand this. I did this through Zoom. I wasn't even in the room with her. I was across the country. So if you are having symptoms, and especially right now, this particular session, I'm talking about this video, I'm talking about knee, but any symptom, don't think you're going to get the answer to what's causing your symptoms, what tissues in distress through the medical system. They can't identify all, including muscular causes, which happen to be the cause in 98% of cases. You need the YASS method. If you want to get the YASS method, you contact me directly through my email, drmitch@mitchellyass.com, drmitch at mitchellyass.com, drmitch@mitchellyass.com. If you've recognized by watching this video or getting any other information through the YASS about the YASS method that you think the answer is to get an evaluation and treatment through a Zoom session, by all means, contact me by email, drmitch@mitchellyass.com. If you like this video and a light bulb is going on saying, oh my God, what he's saying makes sense, and yeah, I don't think that the medical system globally anywhere is going to do the trick for me, give this a thumbs up. Let people know that there's value in this video. If you think that the videos I'm providing on my channel make sense and are benefiting you, getting you clarity to understand how to come to the right diagnosis and treatment, then subscribe to Dr. Mitchell YASS, the YouTube channel, because you'll get notifications as to when I'm putting new videos on and when I'm live on YouTube. And I'm trying to get these videos on 1 to 2 a week. And they're about all different types of areas, whether it's locations of pain, what creates pain, the actual exercises, how to be done. It's really about functionality. So it's a wide range of issues I discuss, all applicable, all with the intent of helping you to get the information so you can resolve your symptoms and become fully functional. Please subscribe to the channel. So for now, this is Dr. Mitchell YASS wishing you a pain-free, fully functional life. Let's work together. Let's resolve chronic pain globally. Bye-bye for now.